5 years. When we examined her, we found that her pain was coming from the piriformis muscles. She also has sciatic pain down both legs. So many patients with piriformis muscle syndrome cause back pain plus leg symptoms that mimic sciatica. Piriformis syndrome is the second most common cause of sciatic symptoms down your legs in the world. Second most common cause. The first being a pinched nerve in your back called radiculopathy. We're going to get started. Let's show the audience how the piriformis muscle injury can cause so much pain in the buttock and down the leg while we get started.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Now, just to show you guys, now that you watched the video, lower back pain that's chronic, means it lasts more than 2 weeks, has 30 very specific sources, 30. And the piriformis muscle, it runs from your tailbone over to the top of your hip. And you've got a right and a left piriformis, okay? Very common for people to get a tear in the muscle. It could be here, closer to the tailbone, could be here, closer to the hip bone. And the sciatic nerve comes off of your spine. It's 5 nerves come together, make one big nerve that runs right down your leg, okay? The number one cause of sciatica is a pinched nerve in your back from a herniated disc. It's called the nerve root. It gets pinched or irritated. The second most common cause of sciatic symptoms is right here, a piriformis muscle tear that gets inflammation, swelling, it's angry, and it gets right on that sciatic nerve. That's what this patient has. So I developed and patented a new way of releasing the piriformis muscle. It's never been done before. It's minimally invasive. It's done with a 4mm cut right there. You can see we've already finished one side. We're moving on to side number 2, which is her right. If you have questions, ask them, because we're going to be done in about 5 minutes. Shot? Perfect. All right. We made our second 4mm incision. I'm going to work down to the spot where we do our Deuk piriformis release. Again, this is a procedure that I patented and developed. We've performed about 400 of these to date with a success rate of 100%. Elimination of piriformis pain and symptoms. Any questions?
No questions.
Shot. You can see the piriformis fossa, where the piriformis muscle attaches to the medial surface of the greater trochanter. A lot more on this side, huh? We have more scar tissue on the right. than we had on the left. But we're done. Thanks for joining us. Let's share with the audience one of our patients who had this procedure done in the past and is happy.
I'm Dr. Deukmedjian. I'm here with my patient from California. He traveled to California to come to the Deuk Spine Institute because he had herniated discs in his back that were causing some back pain, but mostly leg symptoms, so sciatic type pain. He also had a piriformis muscle tear that wouldn't heal. And how do you feel today after your surgery?
Much better.
Yeah?
Absolutely. It's noticeable already, even with the little incision and whatnot. I feel a little emotional. It already feels like it's life-changing.
What was life like for you before your surgery?
For the last 6 weeks, I've basically been couch-bound or bed-bound. I get up and walk around for about 15 to 20 minutes, and then I had to get
Incapacitated with.
completely.
And where was this pain?
Basically from my L5, like high butt, down to my toes with numbness and tingling in my toes. Loss of sensation.
You still have that pain today?
No,
It's gone.
it's gone.
Congratulations. And is it gone because we have you on pain meds, or?
No, I haven't had any pain meds. I took 2 Tylenol this morning, and that's it.
So normally you'd be in pain.
Yes. By this point in the day, I was already smoking weed, taking edibles to try and manage it to get through the day.
That's tough.
It's incredibly noticeable to be here with you guys right now.
So yesterday you had your surgery. We found that you had tears in the back of 2 discs, L45, L5S1. I used the laser to clean the tears, and you had a gigantic herniation of L5S1 that was pinching the nerves going down your leg. That's why you're having so much weakness, but your weakness is gone today.
Yeah, I was already able to stand up on my toes, which I haven't been able to do in at least 6 weeks.
If you watch the video, you can see like we took out around 30 pieces of herniation that made up your big herniation. It went very well. We also fixed your piriformis muscle by releasing it. That's why you don't have that buttock pains.
Yeah, it's much better.
Anything you want to tell your friends and family out there?
It feels like a new me. I actually want to say something to the people that are considering it, because I watched some of the reviews, and some of the negative reviews had me a little concerned, and then I watched a lot of the videos, and that provided me some confidence. And getting to watch the actual procedures was very reassuring. And then when I got here and got to meet all the staff and how professional, I was blown away. And my wife, who is a nurse and has incredibly high standards, pulled me aside yesterday before the surgery and said, "Hey, listen to that. Do you hear that? Everybody that's talking is either talking about a patient, talking to a patient, or they're doing their job. There's no gossip." Just so impressed.
Thank you. Yeah, we have a few negative reviews, but they're by people who either didn't have surgery and are upset because they have to pay out of pocket, which is understandable. You know, I'd be upset with my insurance company too.
I'd pay out of pocket in a second for this.
Thank you. And the other ones are ones who did not do everything we recommended. So sometimes people have 4, 5, 6 causes of back pain. You had 3 and you did all 3. So, but some people have 6 and they only do 2. So of course they're going to have pain afterwards. We tell them that. We don't like the fact that people have to pay out of pocket when they do. We want their insurance to pay, but some insurances refuse. So what can you do? Well, I'm glad you guys came, and I know you're going to do fantastic.
I appreciate it. Thank you for taking the time and getting us in, and you've changed my life in a direction that I was questioning would be possible.
It is possible at Deuk Spine.
Yeah,
Congrats.
it sure is.
And go enjoy the rest of your life.
I'm going to.